When starting HRT, one of the biggest decisions we make is how we're going to administer our medication. There are several different routes that we can take for our medication, but it's sometimes difficult to decide which routes you're going to take. So for this episode of Stacy Links Presents, I'm going to talk about medication routes. I'll be right back. Alright, so welcome to my channel. I'm Stacy, and in this episode I'm going to talk about medication delivery routes with regards to HRT. I'll talk about each of the different types of medication routes that you could choose from, plus I will talk about the pros and cons of each route. There are benefits and there are risks to each type of route, so I will go through them in a little bit of detail in this episode. But before I get started, what I'll get you to do if you're new to this channel and you're a transgender person or a member of the LGBTQIA+ community or an ally who's looking to learn more, make sure you go down below on this episode and hit that subscribe button. And make sure to click the little bell beside to be notified anytime I upload new content to my channel. I have playlists with videos on my makeup routines, tips and tricks, fashion and jewelry that you would love to see. Plus, I'm documenting my transition while being a parent and advocating for the LGBTQIA+ community. And if you're not following me on social media, make sure you're following me on Instagram, Facebook, and TikTok. I have lots more content on those platforms that you would love to check out. Alright, so the first medication delivery route I want to talk about is oral. This is one of the most common ways to take medication. Oral literally means to be swallowed by the mouth. And HRT medications are typically given oral. I take 6 milligrams of lupin estradiol every day. That's the time release formula, which I take all 3 2 milligram pills first thing in the morning, as well as my ciproterone, which I also take in the morning. I take that orally as well. One of the main benefits of oral medication is that you can easily swallow the pills and they start working in your system shortly after. They generally take between 30 and 45 minutes for any oral medication to begin working. However, this is probably the easiest route for many people to take medication. One of the major drawbacks of being on oral medication is that anything that goes through your stomach has to go through your liver as well. So after a long period of time of being on oral medication, it could cause liver damage. Now, if you've never abused your liver by taking heavy drugs or drinking heavily, you should be okay, but as we age and get older, our liver does start to tire out after a while. So we need to be watching our liver panel blood work whenever we go in for our blood work. Another drawback of oral medication is it has the possibility of causing your stomach to be upset. Now, it is recommended that taking this estradiol that I'm on, that I'm supposed to take it with food. Now, I can admit that I don't, because I take it all in the morning with all my supplements and vitamins and everything else. However, it can cause your stomach to be upset. So the next most common delivery route that a person can take for HRT medication, specifically estradiol, is sublingual. What that means is that you will have it dissolve in your mouth. Now, sublingual medications are typically quick dissolving. They're supposed to absorb into the lining of your mouth. Now, one benefit of that is that it hits your bloodstream a lot faster than oral medications and can be more concentrated because the stomach acid has a tendency of destroying some of the medication. So your saliva is not acidic enough to break down the medication. It just breaks it down to the point where it's absorbable in your mouth. Another benefit of that is it doesn't have to go through your liver. As I mentioned, it goes directly into your bloodstream and it becomes effective right away. However, there are still drawbacks to sublingual medication route. The first is you have to take your medication throughout the day. if you're taking 6 milligrams of estradiol sublingually, you will have to take 1 2-milligram tablet 3 times a day. So some people have a tendency of forgetting their dose, which isn't good. If you keep forgetting too many doses, it could cause your hormone levels to drop fairly rapidly. The next drawback on sublingual medications is they are not meant to be swallowed. But for somebody like me who has overactive saliva glands, I have a tendency of swallowing a lot. So it would end up for me that most of the medication would be swallowed with my saliva before it gets absorbed into the lining of my mouth. So the third type of delivery route that I would like to talk about is transdermal. Now, we've had transdermal patches for a very long time. Nicotine patches to aid in smoking cessation are transdermal. What that means is that the medication literally absorbs through your skin and goes to your bloodstream that way. You can get estradiol in transdermal patches. One benefit of transdermal is, once again, it's going directly into your bloodstream. So you don't have to worry about risking liver damage from taking oral medication. However, one drawback to that is after a while, it could cause skin irritation. So when you change your patches, typically once every 4 to 5 days, you have to pick a new location every time. And you can't double up on the same location for at least a month, because that can cause redness and skin irritation and rashes, which is just general dermatitis. But it is definitely something caused by the adhesive of the patch as well as the medication. However, it is a lot more convenient to just change patches every 4 to 5 days than having to take medication all at once every day or have to space it out 3 times a day. A lot of people really prefer the transdermal delivery route for their HRT. Now, the fourth medication delivery route I would like to talk about is not necessarily for everyone, but some people seem to prefer this over any of the other ones, is intramuscular injection. Now, estradiol and ciproterone can both be administered through intramuscular injection. Ciproterone is only administered once monthly. However, estradiol has to be done every 5 to 7 days. So if you're a person who is kind of averse to needles, like myself, intramuscular injection is definitely not the way to go. However, one benefit of that is the injections are a lot more effective. They are supposed to be better absorbing, obviously, because you're injecting it straight into your body. And a lot of people have exceptional results from being on intramuscular estradiol route. However, again, if you're like me and you're averse to needles, it's going to be something very difficult to do. You have to do an injection every 5 to 7 days of your hormones. And having to deal with needles and having to deal with the syringes themselves, disposing of the needles, making sure that you have sterile needles and a sterile environment to do your injections. So there's a lot to consider still, even when you decide, or if you're deciding to go intramuscular injection. And because it's directly to the bloodstream, one benefit is it misses your liver. So that's something to consider when deciding what delivery route to take. And now, last and certainly not least, this has got to be probably the least common delivery route for HRT medication, but there are a lot of people who have considered it and are on this route, is implants. After a while of being on estradiol, a person would have the option to switch to implants. And now these are like little tablets that are implanted in your skin, usually around your pelvic area or near your back. And they administer estradiol at a constant rate, and they last for 3 months. One benefit is you first don't have to worry about taking medication every day or once a week. You don't have to worry about changing patches. You don't have to worry about injections, sterile needles, all that kind of stuff. The drawback is that it is a surgical procedure that is done to cut a little slit in your skin, implant this tablet, and then stitch you up after. And that has to be done once every 3 months. So if you're a person who doesn't mind minor surgical procedures and you're willing to have an implant for your HRT medication, this is probably the best delivery route that a person could go on, because you do it once and then you're good for 3 months, and then you go back and you get another one put in. They put it in a different location. Again, the drawback is you have to deal with an incision that takes several weeks to heal, and having to go back every 3 months to get this procedure done can be a hassle after a while. But again, this is probably one of the safest routes to take when it comes to going on HRT. So now, in conclusion, the only reason I've done this episode is for information purposes only. I myself would not go on any other delivery route other than oral. That's what I'm on now, and that's what I'm happy with. It's effective for me. I have no problems taking 6 milligrams in pill form every day, because I just take all 6 milligrams once in the morning, and then I'm good for the rest of the day. But some people, that route isn't as effective, and they'll have to go on to something that's a little bit more effective. Transdermal is generally rated as higher efficiency than oral or sublingual. Injections are even higher than transdermal, because the skin doesn't absorb all of the medication that's in the transdermal patches. However, an injection will give you all the medication that you need for a week, and then you just have to do it once a week. But again, considering all the drawbacks from all of the other delivery routes, I still prefer oral over any other. I have a strong liver. I've not had any liver problems. I've never abused my liver in any way. So I'm definitely happy with the route that I'm on. You may want to go on a different route, which may be more effective for you. So I hope this episode helps you to decide a little bit more as to which route would be best for you. Alright, so thanks for watching. Make sure you go down below and hit that thumbs up button, and drop me a comment if you're a trans person on HRT. Tell me what your delivery route is and why you've decided on that route. If you are a trans person who is considering HRT, drop a comment again if you have any questions with regards to any of these delivery methods. I'll do my best to answer your questions. But I hope that I was comprehensive enough in this episode to help you make your final decision on which delivery route would be best for you. So thanks again for watching. Stay tuned for my next episode, and we'll see you then. Bye!